Coming up next on It's Personal, brought to you by Gundersen Health System. The FDA is targeting salt in our diets. We're going to talk with a registered dietitian about where salt is lurking in our food and how we can better manage it ourselves. Also, a little bit later, preparing for a mass casualty event or any type of disaster. Are we ready in this area? We're going to discuss that with emergency management from Gundersen Health System. And a little bit later, there are new laws in Wisconsin protecting Good Samaritans, and you're going to learn what that's all about as well. It's all next on It's Personal, brought to you by Gundersen Health System.
Unless you're from Ethiopia, you won't fully understand this, but you might gather that 9-year-old Abo is excited. Thanks to our eye doctors volunteering with Gundersen Global Partners, he can now see his friends at the new school and a future worth living. It's just one of the ways Gundersen Health System is combining love plus medicine. Learn how you can help at gundersenhealth.org/globalpartners.
Welcome back to It's Personal, brought to you by Gundersen Health System. I'm Chris Stauffer. Well, if you haven't heard, the Food and Drug Administration is leaning on the food industry, and they're doing so to cut back on the amount of sodium added to processed and prepared foods. I think it's something a lot of us have heard about, and now there's some action that's being taken. We're going to learn more about that with Jessica Lynn. She's a registered dietitian with Gundersen Health System's Nutrition Therapy Department. Thanks for joining us.
Thank you.
So, sodium, cutback. Is there a lot of sodium already in processed foods?
Yes, absolutely. Sodium is one of the cheapest preservatives that we can put in processed food, and of course we know historically, absolutely. And we know that increasing the shelf life is important for foods because we don't want foods in the grocery store that are going to go bad after a couple days. That just wouldn't be a very wise choice for grocery stores. So we have had a continual increase in the amount of sodium that is being put in the foods that we purchase.
So from what I understand, there is most consumers are not aware of the amount of sodium that they're consuming on a daily basis. The numbers are kind of staggering.
Yeah, it is. Once you really start reading the labels and looking, it is pretty staggering. And more surprising is that foods that are the same across different brands or even in different countries have hugely variant amounts of sodium in it. So once you really start digging into it, it is quite shocking.
Well, I think it's one thing when you pick up a container of peanuts and you know that they're going to be salted peanuts, but it's another thing when you're picking up something from the grocery store. How do I know? You mentioned labels, but not everything is labeled. Is that what the FDA is now going after? Right.
The FDA is going after a lot of the processed foods specifically, and those are going to be the foods that contain a label. A lot of foods that are just whole foods that you purchase, fruits, vegetables, those fresh meats, those sorts of things are going to have much less sodium than their processed counterparts.
All right, so the fresh is always the better. Anyway.
Fresh is always better if you can, yes.
And if more people are eating fresh foods, then they wouldn't sit on the shelf as long.
Absolutely.
All
yep.
Right. What are the why is sodium bad for you?
Sodium, when we're speaking about sodium, it's a contributor to heart disease. So we know that the more sodium that you eat in your diet, the more likely you are to have high blood pressure, and high blood pressure is a contributor to heart disease. Heart disease is a really big cause of death amongst Americans.
When you talk to your clients, what foods are they maybe surprised that have large amounts of sodium in them? Some things that maybe they should think twice about.
Yeah, probably the most surprising one where you'll find sodium is going to be bread. So the baked bread that you buy that comes in the plastic bag that you purchase at the grocery store.
Really?
That is a very shocking one. In fact, for a lot of school districts, to be able to find breads that are low enough in sodium to fit the restrictions that they're required to follow is a big challenge. So bread is a big one to look out for. Canned foods, a lot of those foods will have added sodium thrown in there. But yeah, reading the labels of anything and looking at that sodium amount is going to be important.
Are there other ways that foods can be preserved in a safe way other than using sodium?
Yeah, absolutely. And even just lowering the expectation for how long your food is going to last and purchase food, for the week or for the next couple of days, and being able to keep those fresh foods on hand is a good way to combat the amount of sodium that you might be intaking unknowingly.
I think a lot of people, what they'll do is they'll buy, fresh foods and then they'll freeze it. Is that a good idea? Is that, is the freezer sort of like, your backup plan if you can't get through that food?
Yeah, absolutely. That's our recommendation. If you can't go fresh, go frozen. Avoid the canned foods, especially for fruits and vegetables. If you can, you're going to be throwing more sodium and more sugar in there as well. But yeah, if you can't eat something right away after you purchase it, freezing it is usually a viable option. It varies a little bit between foods, how freezing it might affect the nutrient content, but for the most part, it's a solid alternative.
We're talking with Jessica Lynn. She's a registered dietitian, nutrition therapy department at Gundersen Health System, about the FDA guidelines targeting the sodium that is hidden in many of our diets. Is the FDA getting involved here because it's gone too extreme, you think? Maybe some foods are just really sort of like taking advantage of the lack of guidelines?
That could very well be. I mean, looking at it from the FDA's perspective, this actually isn't a federal mandate. It's more of a recommendation. So they're not requiring these companies to start looking more closely at the amount of sodium in their food. But what we're seeing is a lot of companies are already doing this without the FDA's guidelines. And it is a pretty common thing around the world at this point, that there are a lot of countries who are following these guidelines. But in my opinion, the FDA is concerned a lot about the cost of poor diet and poor lifestyle and how that influences our health and how that influences the amount of money that we're spending on health care. So I did actually read somewhere in the research that was done to support this movement is that they actually think that over the next decade, by reducing American sodium intake to 2,300 milligrams per day, which is the recommended amount, about the amount of sodium found in a teaspoon, we could actually save over $100 billion in healthcare costs and 500,000 deaths saved from the American population, which is huge.
It is an extremely staggering number. I mentioned that a little bit earlier, that some of the amounts of sodium in your diet is staggering, but then the results.
Yeah. And what we're really looking at, about the average American is consuming about 3,400 milligrams per day, so about a teaspoon and a half. And all we're asking is to go down to about a teaspoon, which, if you start looking at it, really isn't that significant, but the ramifications are huge.
Well, your tips are to buy fresh, to read labels. What other things can we do to reduce sodium in our diet so we stay healthy?
We as dietitians like to tell people, every time you go to the grocery store and you make a purchase, you're making a vote. So every food that you buy, you're voting for that food. So if you're continuously buying foods that are high in sodium, you're not going to give the food industry any motivation to be decreasing the sodium that they're using. So people really, I don't think, realize how much of an influence they have on the industry versus how much the industry influences them. So the more you can educate yourself and make your purchasing choices based on what you know, the more the industry will be kind of forced to follow suit, because they have to be putting foods out there that people are willing to purchase.
I think there's a lot of people out there that say, I like salt. I love the way salt tastes on my potato chips, or even on my mashed potatoes, or whatever that may be. What's your advice to them as they're just even reaching for that table salt?
Yeah, absolutely. The first piece of advice we usually give is to throw away the salt shaker if you can. And it's not something that for most people you can just do right away and be okay with, but slowly decreasing the amount of salt that you're adding to your food until it gets to the point where you can just throw away the salt shaker and not be adding anymore. As far as seasoning foods go, trying things like herbs and spices. If you put lemon juice on your vegetables, it tastes similar to what's the taste that salt adds to your vegetables to do that. But for people who just generally like salty foods, if there are foods that you enjoy that have an excess amount of salt in them, you have to make adjustments somewhere else. So you can't be having all of the food that you're eating be high sodium content foods. just have to make choices as far as which foods are most important to you to be including.
Making choices, making votes.
Absolutely.
As you said. Final question for you. I know there's a lot of people that are listening to this program going, well, it's not just me. Sometimes it's my spouse or it's my grandchild or whatever. What's your advice to try and help others? Does it have to be a personal choice, or can I give a tip on my own to say, hey, that's a lot of sodium?
Yeah, it's always a fine line. It's always a fine line between offering people unsolicited advice, which sure. We all know in the healthcare industry doesn't always get received very well. Right. But just really being the best example that you can be. And if you're the person in your household that prepares the food, you kind of have the control there. So helping your family that way to make better choices is a good option. But yeah, just being the most political you can while still urging your friends and family to make the best choices they can.
We talked a little politics today with voting and being political.
All the ends of the spectrum.
Thanks, Jessica.
Yeah.
Jessica Lynn, she's a registered dietitian at Gundersen Health System in the Nutrition Therapy Department. If you'd like some advice, you can certainly go to our website, gundersenhealth.org, and you can learn more about healthy diets, that's for sure. When we come back, preparing for a mass casualty event. Are we truly ready in this area? We'll find out next on It's Personal, brought to you by Gundersen Health System.
As someone with cystic fibrosis, I spend a lot of time at Gundersen Health System. The doctors and nurses have become kind of like family. After a recent stay, I was hoping to go home when my nurse, Angie, told me I'd need to stay another day. Well, I wasn't very happy, and I might have let her know it as she left my room. A few minutes later, in walks someone dressed as a superhero. Mask, cape, boots, the whole deal. I didn't know who it was at first, but when she put her hands on her hips and said, "I heard someone isn't having a very good day," I knew exactly who it was. I've never laughed so hard in my life. Once again, my superhero nurse had saved the day.
Gundersen Health System employs the very best staff in the region, but it's their creative caring that makes them some of the best in the world. We call it Love Plus Medicine. Learn more about Gundersen hospitals, clinics, and specialty services at gundersenhealth.org.
Welcome back to It's Personal, brought to you by Gundersen Health System. I'm Chris Stauffer. Well, with mass casualty events like the one that recently occurred in Orlando, Florida, a lot of people ask the question, how is the La Crosse area prepared? Here to talk about that is Tom Wright. He's emergency management for Gundersen Health System. Thanks for joining us.
Thank you for having me. Good to be here.
Nobody likes to talk about mass casualty events, but yet it's your life. It's what you have to talk about all the time, and you have to train people for and drill people for at Gundersen Health System and really in the community. What are the challenges that you're facing for things that occur like in Orlando or other examples around the country?
Well, all of us in hospital emergency management prepare for what we call an all hazards approach to disasters. So whether that be large-scale fires, tornadoes, active shooters, the plans that we put in place, the plans that we test to know if they're going to work or have any chance of working, we drill with some frequency. And so for that reason, whether people are harmed with bullets or by flying debris from tornadoes or burned by fires, all of us have a responsibility to our organizations, to our communities, to actually prepare for anything that could happen. And while that's, it's a little unsettling sometimes to say, well, we'd like to practice for any specific hazard, you just never know which hazard you're going to be faced with. So we do the all hazards approach.
That's a good way of looking at it. Maybe that begs the question then. We are here to talk sort of about mass casualty events like what happened in Orlando, but is that the biggest risk? What are the biggest risk factors for our area?
Shooting incidents have grown to an alarming rate of popularity. I think what saddens most of us is that each bad event is a blueprint for the next bad event, and hopefully the escalation won't be here. But it rises up, and at Gundersen we do take measures to train staff in active shooter counter strategies, as well as how to manage those patients in a trauma perspective. In the emergency department, surgical department, we work with staff to prepare for large numbers at any given time. Here in the La Crosse area, it has risen high in significance, along with other things. 2011 taught us that we are not immune to tornadoes, as certain wives' tales may have suggested. Right. So for that reason, we've put protective measures to harden ourselves from that. Other things of less severe in terms of numbers of casualties is cyber criminals. What people will do to hack into systems and hold them ransom. So we put plans in place for things like that. So we're only limited by the imagination of those who want to perpetrate bad deeds.
There was a conference not long ago talking about cyber attacks. What did you take away from that conference in La Crosse?
It was very enlightening. I know that healthcare organizations that have been held ransom, the authorities say, do not pay that ransom.
As they did in California recently.
As they did in California, exactly, with Bitcoin. And strange term to a lot of us. I'm actually well familiar with it since that conference. I didn't really know what that meant prior to. But all of those things are hazards that have to be planned for. What are you going to do if there is a community disaster and you're the only place with the lights on? How are you going to manage people that want to come into this hospital because you have lights on and we've lost our house? So it's absolutely stymieing to think what can we do for things like that. But the cyber conference itself, I don't think any of us who attended that conference were that aware of how pervasive and how easy this type of crime is. So that was a very eye-opening piece that really, I think, called a lot of us to action in terms of what are we going to do to not only protect very smart people managing our infrastructure for IT, but if it would happen, then what? Do we go back to paper? Which is something that hospitals practice. Those with electronic medical records do from time to time during down events, do practice the old paper and pencil technique of that. And then how do we get those back in the system as we come online? So there were many eye-opening things from that.
One of the things that I know that you took away from that is that that hospitals are more susceptible to cyber attacks because of patient information being more valuable compared to information from stores, health information because of drug use. Kind of an amazing thing to hear that patient information might be as valuable as $50 per patient on the black market.
Right. Which, doesn't seem a lot, but personal finance information's worth much less, and for me that was an eye opener. But it gains. The criminals actually seem to gain an insight and maybe access to, if it's a motivation for drug access, they gain that upper hand on us, and that's terrifying to think.
And health systems trying to protect themselves from places like Russia, China, all over the world. Really, attacks come in daily.
Right.
Kind of an amazing thing. We're talking with Tom Wright, Emergency Management at Gundersen Health System, about preparing for mass casualty events or really any kind of an occurrence that could happen in our community. Recently, this past week, a drill held at Central High School, and the drill was an ammonia leak put on by students from Gundersen Health System to try and, I guess you could say, roll in the entire community and prepare for just what we're talking about, emergency response. The need for these drills is immense.
It's absolutely critical. And as we perpetrated that drill, what we looked at was our ability for people here at the hospital specifically with an impressive decontamination system. We took an assumption that not all patients at that incident would have been decontaminated by on-scene fire command. For that reason, we did want to test our own for people who may have fled the scene and presented into the medical center with complaints involving that explosion, maybe that product that was on them, and to test our ability to actually wash in our own walls, and at what point do we let them into the hospital to avoid any contamination from that product.
Because more people could be injured if there's contaminated individuals, just walking around or walking into an emergency room.
Precisely.
All right. Well, Tom, we're just about out of time, but I do want to give you the opportunity to talk about if somebody's at home thinking about trying to be prepared for any kind of an emergency. Do you have any advice for the individuals that might be listening this morning?
Absolutely. All individuals, as part of their prudent plan for home disasters, whether it be an in-home fire, whether it be a natural disaster such as tornadoes or severe storms, is to develop a plan that you have at home that includes a go kit. That each member of the family has things pre-stored in a easily accessed suitcase, clothing to wear, drinking water, energy bars, things that if you were displaced until you knew where you were going, these are things you would absolutely need, including your cell phone's charger, so that at some point you're going to need that. And then a communications plan. If you're forced to evacuate without any ability to give notice to other family members in other parts of the country or perhaps other parts of the world, is have a communication plan either through telephone communication, social media, who do we call first, and ask those people in areas not impacted to actually notify other family members of your status, that you're okay.
And there's a lot of individuals out there saying, no, this isn't going to happen to me. I don't have that big of a risk. But like you said, there's tornadoes. There's trains going through our community. There's trucks going through our community on a daily basis with, hazardous cargo. Who knows how close that's going to be to your home?
Right. Chance favors the prepared mind. And those who say, well, it may never happen, but if it does, we're ready to go. And keep your go kit handy.
Yeah, there you go. Tom Wright, Emergency Management, Gundersen Health System. Thanks for joining us.
Thank you, Chris. It was my pleasure.
And we're going to be back in just a moment here on It's Personal, brought to you by Gundersen Health System. When we come back, new laws in Wisconsin are now in place to protect Good Samaritans. We're going to find out why. Again, that's next on It's Personal, brought to you by Gundersen Health System.
My husband, Wally, spent a week recovering at Gundersen Health System. He's really patriotic, so he was a little bummed out that he'd be stuck there for the 4th of July. So after dinner, we rolled up to floor 6 for our usual walk. But something was different. There were people gathered up there, all smiling at us. Because at the end of the hall, right by a giant window, we saw a love seat, a flag, and a sign that read, "Per Dr. Botner, reserved for Wally." We could see the fireworks perfectly framed through the window. It was almost as good as seeing them down by the river, but with an extra bonus. No mosquitoes.
At Gundersen Health System, our staff of specialists, doctors, and nurses try to make the best out of every stay. It's a philosophy of care we like to call love plus medicine. Learn more about Gundersen hospitals, clinics, and specialty services at gundersenhealth.org.
Welcome back to It's Personal, brought to you by Gundersen Health System. I'm Chris Stauffer. Well, there are new laws in Wisconsin protecting Good Samaritans. Telling us about that is Erica Kane, Trauma Injury Prevention Coordinator at Gundersen Health System. Thanks for joining us.
Thank you, Chris.
So these new laws are really to protect individuals who happen to stumble upon a hot car. And we've seen this in the news. It's happening all around the country where there's a pet in a vehicle or a small child, or even the elderly. And I think what's happening is there's a lot of people that are stumbling on these cars and not sure what they should do. What should they do?
Well, you're correct. The law is in place to protect those good Samaritans that come across a hot car with a child or even a pet inside. And the best recommendation is to start by calling 911 and to speak with the first responders. They'll be able to really give you the best direction on what to do next and what signs to look for if the person is in distress. And the law is in place that would also protect someone from forcibly entering a vehicle that has a child or a pet inside of it. Now, this might sound like common sense, but of course, checking to see if the vehicle doors are locked. Of course, we don't want people breaking into vehicles when the doors are open in the first place.
It's a good point.
Yeah.
There's a kind of a protocol here, but it sounds like just the first thing might be just walking up to the door and checking to see if it's open, and if there's a child inside, maybe seeing if they have been in there for a while, if it is hot in the car.
Yes, correct. And unfortunately, most of the fatalities that sadly happen due to children left in hot cars are among children younger than 2 years old. So what may happen, a parent might quickly go into the store and leave a sleeping child in the vehicle, and they're safely locked up in their child passenger safety restraints and unable to get out of the vehicle. So really who's at greatest risk here are those very young children that wouldn't be able to escape from a dangerous event.
Right, and I've heard that the same situation has happened for elderly individuals as well. They might be, waiting for someone to return from an appointment, for example.
Yeah, definitely. A hot car is not a safe place for anyone, regardless of how old they are. And people are very surprised to hear how quickly cars really can heat up. It's basically like the greenhouse effect inside of your vehicle. If the day is 80 degrees outside, it takes only 10 minutes for your car to heat up to about 110 degrees. And 104 degrees, we start having organs shut down. If the body temperature goes up to 107 degrees, we're looking at death. So certainly, especially on a hot weather like we're having, we don't want anyone left into a vehicle.
We're talking with Trauma Injury Prevention Coordinator at Gundersen Health System, Erica Kane, and one of the things that I think some people are just shocked that people are leaving their child or a pet or a family member in a vehicle. Mm-hmm. Why is that happening? Are people forgetting, or are they just not realizing how hot the cars are going to be? What's happening?
Well, I think it's a little of both, but the data tells us that as far as fatalities are concerned, most of the fatalities are among children whose parents have accidentally left them in the vehicle. And sadly what happens, it's more likely to happen if a parent is doing something out of their ordinary routine. So we kind of go on that autopilot, right? You leave for work in the morning, you're taking your kiddo to daycare or to school, and then you go off to work. There's been some really sad cases where loving, well-meaning parents had some kind of disruption in that usual routine and accidentally left a child in the vehicle. And we do have some recommendations for how we'd like to prevent that from happening.
And that's what I wanted to hear. I wanted to ask, what are those tips so that you do not forget that child in the back seat?
So we suggest creating reminders for yourself. One reminder you could create is leave your cell phone or your purse or your wallet in the back seat by your child. And that way you're really forced to go back to the back seat. You'll be forced to see that your child is there and wouldn't have the opportunity to make that fatal mistake. We've also heard of parents using a teddy bear or a toy or something that they keep in the child's safety seat when the child is not there. And then once you place your child in the safety seat, move that stuffed animal to your front seat. That way, when you see that stuffed animal in your front seat, it's a sign to you that you've got a kiddo in their safety seat.
Some excellent tips. Any other things that people should be aware of when it comes to hot cars?
Well, I would remind parents that children do not respond to heat the same way that we do as adults. Their body temperatures go up 3 to 5 times faster than ours do as adults. So really, even if you think for yourself, oh, I could sit in this car for 10 minutes, that car is getting hot a lot faster than you think, and the child is experiencing it very differently than you would.
Yeah, plus in the car safety seat, plus in diapers or extra clothing to keep them,
Exactly.
Mm-hmm. All right, thanks, Erica. Erica Kane, Trauma Injury Prevention at Gundersen Health System. That does it for this edition of It's Personal. If you'd like to learn more about any healthcare topic, you can go to the Gundersen Health System website at gundersenhealth.org. For It's Personal, I'm Chris Stauffer. Thanks for joining us.